The Maternity and Neonatal Safety Improvement Programme has two key work streams. The first one is the optimisation and stabilisation of the preterm infant, and the second one is the early recognition and management of deterioration in women and babies. The optimisation and stabilisation of the preterm infant is important because when babies are born early, then they have potentially more serious health problems. The key thing is to remember with this work stream is the earlier the birth, the higher the risk. What this work stream does is look at implementing 9 key interventions, some of which happen with the mother and some of which happen with the baby. We've made huge improvements across those 9 interventions, so that's been absolutely brilliant to see. What I would say though is there is still work to do on some of those areas, so our challenge now is to continue to work making those improvements to ensure that every woman and baby receives the interventions they need to reduce the impacts of preterm births. For the early recognition and management of deterioration for women and babies, this work stream is important because when recognition and management is delayed, it can cause serious health problems again for women and babies. What this work stream is doing is looking at implementing 2 escalation tools. So the first one is the maternity early warning score. So this has been developed nationally and is referred to as the National Muse. The second one is an update of a tool which is already out there called NEWT, and it's the Newborn Early Warning Trigger and Track tool, and it's called NEWT 2 because it's an updated version. So what we need to do in North East and North Cumbria is to implement those effectively. The thing is, it's not as easy as saying, here's a tool, just implement it. It's got a lot of factors which affect that implementation. So for example, just one factor of that is every member of staff needs to be trained, so they need to be confident and competent in the use of those tools. So when we think about, so the success is we've got these tools, which are brilliant, but our challenge is the effective implementation of them.